All right, Alejandra Alvarez. So before we get you discharged and on your way home, we do need to go over some information regarding the medication that doctor has prescribed for you. You are going to be taking Meropenem. It is also called Merrem. This is a carbapenem antibiotic. It is a bactericidal, so that means it works to kill the bacteria that is causing your infection, Alex. It does this by preventing cell wall synthesis. So it weakens the wall of the cell and then it leads to death of the cell. This is a heavy hitter antibiotic, Alex. It is only prescribed for serious infections. It can treat a range of infections in regards to the respiratory tract, urinary tract, some skin infections, and intra-abdominal infections as well. It is an IV antibiotic, so you are going to be going home with that PICC line that was placed while you were here in the hospital, but we'll make sure you have all the supplies that you need, as well as getting visits by a home health nurse to ensure that you are efficiently self-administering this antibiotic at home. Now, you are going to be taking this for the next 14 days, every 8 hours, and you're gonna run that antibiotic over 3 hours. So make sure you take care of whatever you need or have whatever you need close by so that when you do go to administer this, you can let it run over those 3 hours. And again, that's every 8 hours for the next 2 weeks. So with any medication, but especially antibiotics, Alex, there are some adverse effects to be on the lookout for. The first one and the most common adverse effect of Meropenem is going to be GI upset. So you might experience some nausea or some vomiting. Eating before administering the medication might lessen that effect. Another thing is superinfection. So that's an infection on top of the infection that we are trying to treat with this Meropenem. And one way to avoid superinfection is taking a probiotic or having some yogurt daily. And Alex, a potentially fatal and very serious side effect of Meropenem is pseudomembranous colitis. This is also called antibiotic-associated colitis, but it is most commonly known as C. diff, which C. diff can occur when taking antibiotics because the bacteria that are in the gut or in the GI system react to the antibiotic and overgrow. So this can cause watery or bloody diarrhea, abdominal tenderness, abdominal pain, and cramping. So if you have any of these symptoms, do call your provider. They may want to test for C. diff, and if that is in fact positive, you might need an additional antibiotic in order to remedy that. These symptoms can come up as soon as 1 or 2 days after beginning your course of Meropenem, but they can even pop up even months after completing that 2-week course. So do call your provider if you have any of these symptoms. Another thing, Alex, because you haven't taken this medication before, is we're gonna have you on the lookout for any symptoms of an allergic reaction. So we're gonna have you monitoring your skin, looking for rash or peeling of the skin, but then also trouble swallowing or breathing. Again, call the provider because these might be symptoms of an allergic reaction and we might need to prescribe something different. All this information that we went over today, it is available on Micromedics, Lippincott, and Karch's pharmacology book, but I'll send you home with some printouts as well. And as I mentioned, a home health nurse will also be visiting you. I hope this was helpful, and let us know if you have any questions, and I hope that you are feeling better soon.